when do you think PTs should refer the patients to you? What signs, or what are any tips or anything that you see that this patient needs more attention and needs like a consultation? And on the other way as well, so do you refer all the patients, or there are some types of patients that you don't think that they need physical therapy, or how you decide that?
So from my end, in terms of referring to physical therapists, by the time the patient actually gets to me, they are typically in desperate need of working with a physical therapist. So it's been either so many months or so many years that a physical therapist is definitely an essential player on the team. So I'd say I can't even think of one patient that has not gone to physical therapy for their pelvic floor. And then as far as when should a physical therapist refer to someone like me, would be really early on in the process, actually. I think this is sort of a misconception that, the doctor might take the patient away from physical therapy and they haven't, the physical therapist hasn't done everything that they can yet for the patient. But I think particularly in our specialty, it's really important for us to work together. And say, for example, a patient that has groin and pelvic pain and has not had any imaging of their hip, for example, that's something that I can order and we can evaluate for the patient. And for example, if they have either a hernia that comes up or a labral tear, those are things that certainly a physical therapist can work on, particularly with a labral tear. But there may be something that like an injection that we could do early on in the process to get the patient better faster and be able to actually participate better in their therapy process. Because when a patient has too much pain, as you know, they can't necessarily do all the exercises or the stretches that you want them to do. So by working together early on, I think we can make the progress for the patient much, much more quickly.